The man on the table was screaming before the blade even touched him. He had been given wine, a full bottle, poured down his throat by two assistants who held his arms while he choked on it. The wine did nothing useful. The man kept screaming anyway, straining against the leather straps that bound his wrists, his leg elevated and exposed, a saw already moving toward it that Taepyeong could see clearly from the crowd. The saw was dark at the teeth. It had not been cleaned. Taepyeong stood at the edge of the viewing pit and could not move. The room was not a room exactly. It was a tiered pit, ringed by seats, and every seat was full. Men in fine coats leaned forward to watch. Students with notebooks pressed against each other near the front row. Someone near the back was laughing. The surgeon below moved with total confidence, fast as Taepyeong had ever seen anyone move in a clinical setting, and the leg came free in under 20 seconds. The crowd erupted, not in horror, in applause. The limb dropped into a bucket. The patient went limp. Taepyeong counted the details automatically, the way 12 years of surgery had trained him. Dirty instruments, no sterilization, no real anesthesia, a bleeding wound left open in a room shared with cadavers. He pressed his knuckles against his mouth and looked away from the bucket. He knew exactly what was coming for that man. The infection would begin within days. The fever would follow. Nothing in this world was capable of stopping it. This was 19th century London, and medicine here was a performance. To understand why a young Korean man was standing in a surgical pit having a quiet internal collapse, it helps to go back to where he actually came from. He was not as young as he looked. His name was Kim Taepyeong, and he had been born twice. The first time was in South Korea, in a life he remembered completely. He had been a general surgeon, competent, dedicated, the kind of doctor who answered his pager at 3 in the morning without resentment, because the work was simply the work. He had no wife, no close family. His parents had died before he finished his training, and the hospital had become the closest thing to a home he knew. 12 years of it, long hours and too many patients, and a bone-deep certainty that stopping felt worse than continuing. Then the cancer came. It arrived quietly, the way serious things often do, a shadow in a scan that no one expected. Within a month, the diagnosis was terminal. The doctors gave him weeks. He spent most of them working, because sitting in his apartment thinking about what he was losing felt worse than being in the hospital. He received his professorship on a Wednesday. He never saw the office. He stepped outside to get food, walked into the road without looking, and a delivery vehicle hit him. He remembered the sky above the road, then nothing, then crying, his own, high and thin and foreign to him. He opened his eyes in England. He was small. The ceiling above him was wooden and low. A woman was holding him and speaking words he recognized as English, and he was lying in her arms with the helplessness of a newborn because he was one. The reincarnation had not erased a single thing. His entire first life sat inside him, intact, inaccessible to anyone but himself. The anatomy, the surgical instincts, the memory of every case, all of it packed into a body that could not yet hold a scalpel. He grew up in a village in England, Kim Taepyeong by name, because the woman who raised him had taken him in from a Korean family passing through. And the name remained even as the boy learned to walk and speak and read in a language that felt like a second skin laid over a first. His childhood could have been miserable. Other children stared at him, and some of them followed him home from school with something purposeful in their faces. Joseph Lister got between them. Joseph was 12, same age as Taepyeong, and his family owned the largest house in the county. He had no particular reason to step into the path of 4 boys twice his size, except that he apparently found casual cruelty dull and mildly offensive in equal measure. He planted himself in the road and told them to find something better to do. They looked at the embroidery on his coat and decided he was right. Taepyeong stared at him afterward, unimpressed but genuinely curious. Joseph pulled a small brass microscope from his bag. He had apparently been carrying it around for weeks looking for someone interesting to show it to. He pointed it at a leaf and told Taepyeong to look. Taepyeong looked. He had worked with microscopes that could render individual organelles in living tissue. This one showed him a leaf vein and a smear of pollen. He told Joseph it was very good. Something in the tone of his voice made Joseph laugh. They became friends that afternoon, and stayed that way without interruption for the next 7 years. It was Joseph who decided they should both become doctors. This had something to do with Taepyeong's explanation of why the leaf looked the way it did. He had spent 3 weeks working out how much he was allowed to know at any given age, and the microscope conversation was the first time he pushed against that limit. He talked about cells and structure and the way living tissue organized itself, and Joseph listened with his whole face, completely still, in the manner of someone who had just found the thing they had been looking for without knowing they were looking. Joseph went home and told his father he wanted to study medicine. His father had been expecting a conversation about horses or accounting and took it surprisingly well. He agreed to fund both boys' education on the condition that Joseph at least attempt to make the family look respectable in the process. They traveled to London when they were 18. London was filth and sound and money and poverty stacked until the air itself felt heavy. Taepyeong had expected the smell. The reality was worse. The Thames ran open. The streets near the docks were dense with people and animals and waste, and somewhere beneath the noise of the city, a distant saw was audible if you knew what sound to listen for. He heard it their first morning. He followed it, which was a mistake. The public surgical demonstration at St. Bartholomew's was a scheduled event, listed on a board outside like a market day. The patient was a young laborer with an infected leg, and the surgeon performing the amputation was Dr. Robert Liston, known in London medical circles as the fastest knife in the city. From the elevated seats, Taepyeong could see clearly. The speed was real. Liston moved with extraordinary precision, every cut deliberate, the amputation complete, before most of the audience had finished wincing. The patient lost consciousness from shock partway through. Everyone else seemed to interpret that as good fortune. Taepyeong sat very still and translated what he was actually seeing. A man had just had his leg removed without anesthesia, with dirty instruments, in a room shared with cadavers, by a surgeon who had almost certainly not washed his hands. The blood on the floor had darkened. The assistants handled both the wound and the instruments with bare hands. The bucket that caught the limb looked as though it had caught limbs before. The man would likely die within 2 weeks from an infection that had a name Taepyeong knew, caused by organisms he understood, preventable by procedures he had performed hundreds of times. None of those procedures existed here. The organisms had not been identified. No one in this room even knew they were real. He felt the weight of it settle on him like something physical. This was his world now. He had work to do. Joseph's father got them into University College London Medical School through a donation substantial enough that the dean sent a personal letter. The letter mentioned scholarship and civic virtue. It did not mention the donation. The school itself was nothing like his training had been. He had worked in a facility with sterile theaters, digital records, and filtered air. University College had high ceilings, drafty lecture halls, and a dissection room that smelled the way dissection rooms must smell when preservation techniques do not exist. Students were dying from infections contracted during dissection. Not one or two. Regularly. This was understood and accepted as a professional hazard. The first classroom session went badly almost immediately. Dr. Liston entered and every student straightened. He moved through the room with his arms at his sides and his eyes moving across faces, and when his gaze reached Taepyeong, it stopped. He said nothing. The pause communicated something to everyone in the room. Then he moved on. A student to Taepyeong's left introduced himself as Colin. He was well-dressed, confident, clearly accustomed to being the best in any room he occupied. He added pleasantly that it was unusual to see someone of Taepyeong's background at the school. He used the particular pleasantness that people employ when they mean something the pleasantness is designed to conceal. Taepyeong told him it was unusual to have someone explain a room to him when he had not asked. He kept his voice neutral. Colin's expression shifted slightly. The pleasantness left it. That was, Taepyeong reflected, probably not the ideal beginning to his second medical career. The dissection room was worse than the lecture hall. He stood at the entrance and assessed it the way he had trained himself to assess surgical environments. Exit points, contamination vectors, airflow, surface condition. The floor was stone and dark with old staining. The bodies on the tables were wrapped in cloth used before. Students moved between them with bare hands and no eye protection, cutting and examining with instruments they wiped on their coats. 3 students had died from dissection infections the previous month. Joseph had mentioned this casually, the way one mentions a known occupational hazard. It was simply part of the process. Alfred was at the nearest dissection table. He was young, well-built, with the ease of someone whose family could replace any door he walked through. He introduced himself and offered Taepyeong forceps, pointing at the cadaver. Tapyong looked at Alfred's right hand. There was a small cut on the index finger, recent, already slightly red at the edges. He had been handling cadavers with that hand. He did not say any of this directly. He told Alfred that in his homeland, his teachers believed illness entered the body through invisible disturbances, and that cuts near recently deceased bodies were particularly dangerous because of the concentration of those disturbances near decaying tissue. He said this in his most serious tone. Alfred looked at the cut. Tapyong said he had something in his bag that might help. He had prepared for this. Not the specific patient or cut, but the general situation. He had spent his first weeks in London acquiring what he needed. Vinegar. Strong spirits from a pharmacy. A small knife sharpened carefully against stone. Linen boiled in a pot over the boarding house fire until Joseph asked what he was doing, and Tapyong said it was a Korean cleaning tradition. He cleaned Alfred's wound. Boiled water applied with clean linen, then diluted alcohol pressed into the cut until Alfred's expression moved from curious to pained. He covered it with the cleaned linen and tied it, then told Alfred to keep it covered, to report immediately if the redness spread, and to avoid touching the cadavers with that hand until it fully closed. Alfred stared at him. Then he thanked him and did exactly as he was told. 3 days later, Alfred pulled him aside in the corridor and said he thought Tapyong might have saved his finger. He said this with the gravity of someone who had watched a classmate lose a hand the previous year and understood what that sentence actually meant. He also mentioned that he had a large house in Surrey with spare rooms, and that both Tapyong and Joseph were welcome to stay. Tapyong accepted before Joseph could say a word. Alfred's estate had been added to by successive generations until it contained rooms with no clear purpose and corridors that led to other corridors. One of the outbuildings stored raw materials from the family's business interests. Among them was a stack of rubber sheets imported from South America, with some commercial intention that had not yet crystallized into a plan. Tapyong saw the rubber and went still. Joseph noticed him staring and asked what he was thinking. Tapyong told him he would explain later. He asked Alfred if he could examine the material, and Alfred said of course, it was just sitting there. Tapyong pressed a sheet between his fingers, testing elasticity and surface texture, working through the gap between what he needed and what he had. Rubber gloves. He had performed surgeries in this life with bare hands, and it had been difficult every time. Not physically, but mentally, because he knew exactly what he was introducing into every wound he opened. The solution existed in that outbuilding in Surrey. He needed it thin enough to be useful, and he needed manufacturing access to make it real. He spent the train ride back to London thinking about how to get that, and by the time they arrived he had worked out the solution, which was embarrassing in the way simple answers often are after an hour of treating them as complicated ones. The businessmen were not immediately interested in surgical gloves. Tapyong had secured the meeting through Alfred's family connections. He explained the gloves clearly, framing the benefit around protecting surgeons' hands during delicate work and reducing contamination risk. He was precise and genuinely persuasive. They looked at him with the polite attention of men humoring a student. The commercial case, one of them said carefully, was not immediately apparent. Tapyong shifted direction. He mentioned that the same manufacturing process could be applied to contraceptives. He was matter-of-fact about it, explaining the market, the demand, the deficiencies of existing products, and the improvements a properly manufactured rubber version would represent. The room changed. The men exchanged glances. They asked him to describe the technical requirements in more detail. He walked out an hour later, shook hands with Alfred in the street outside, and allowed himself exactly one moment of relief before turning his mind to the thickness specifications for the surgical version, which was the thing he had actually needed all along. The first prototypes arrived 3 weeks later and were too thick. He had expected this. The craftsman had interpreted his specifications conservatively, as people do when they do not fully understand what the object is supposed to do. He put one on and flexed his fingers, and could barely feel the shape of his own knuckle through the material. Useless for surgery. He went back, gave revised specifications, and drew diagrams on paper. The material needed to follow the finger joints through their full range, sealed at the wrist to prevent slippage, thin enough to transmit tactile sensation during dissection. The second batch was better. He brought them to the hospital, washed his hands with the care he had been training himself to maintain, and stepped to the dissection table. Liston was there. He had not expected that. He had expected a supervised session with a teaching assistant. Liston stood at the head of the table with his arms crossed, and when he saw Top-Yong pull on the rubber gloves, his expression shifted into something that was not quite a frown and not quite curiosity. He asked what they were. Top-Yong explained them as a protective measure from Eastern medical tradition, a way of keeping surgeon and patient in clean contact. Liston looked at them another moment, then he told Top-Yong to take the lead on the dissection. The room went quiet. Top-Yong stepped to the table. He had been waiting for this, not to perform in front of others, but for the first real test of whether his surgical ability had survived. 12 years of skill, embedded in muscle and reflex and the specific way a hand learns to move through tissue without causing unnecessary damage. He had operated on cadavers hundreds of times. The question was whether the body he now occupied had retained anything of what the previous one had built. He made the first incision. The fascial layer opened cleanly. He moved through it with the assurance of someone for whom thinking had become unnecessary. The instruments responding to decisions made below the level of words. The dissection proceeding in the sequence that anatomy dictated. He cleared the fascial plane in the time it typically took his classmates to locate it, separated the structures beneath with precision that came from knowing exactly where each one would be before he found it, and stepped back. Liston had not moved. The other students were looking at Top-Yong with a quality of attention that contained no mockery. Liston examined the dissection. He was quiet for a long moment. Then he told Top-Yong to come to his office that afternoon. Colin, from the other side of the table, was looking at the dissection with his jaw slightly set and his expression arranged into something that was trying to look neutral and was not managing it. Top-Yong collected his instruments, removed the gloves, and returned to his notes. That afternoon changed his position in the school. Liston's office was not a comfortable room, and Liston was not a gentle man. He sat across from Top-Yong and asked directly where he had learned to dissect like that. Top-Yong gave the prepared answer about Eastern medical texts and a teacher in his homeland, adding specific details about anatomical study from old Chinese manuscripts, translated and imperfect but containing genuine knowledge. Liston looked at him with eyes that were more intelligent than his reputation for brutality suggested. He said the explanation was interesting. Then he said he did not particularly care where the knowledge came from, only that it was real, and that it clearly was. He asked Top-Yong to assist him in his next surgery. Top-Yong accepted. He walked back to the boarding house that evening, and sat on the edge of his bed, and allowed himself to feel something he had not been able to identify since his reincarnation. It was the specific satisfaction of being seen correctly, even partially, by someone worth being seen by. His first life had contained very little of it. The hospital had been full of good surgeons who competed in the sideways manner of people who could not directly acknowledge any quality but their own. Liston was nothing like that. He had named something plainly, and that directness was almost disorienting. Joseph knocked on the door and asked if he wanted supper. Top-Yong said yes, pulled himself off the bed, and went downstairs. The hand-washing conflict came sooner than he expected. He had introduced the practice quietly on the ward, starting with himself and Joseph and Alfred, and framing it as a personal ritual, not making demands of anyone else. A few nurses adopted it without being asked, the way practical people sometimes adopt practices that appear to produce better outcomes. Colin noticed the reduced infection rate among Top-Yong's patients and decided he resented it. He challenged Top-Yong in the corridor outside the ward, loudly enough for the nurses nearby to hear. He said the practice was superstition, that it was consuming students' time unnecessarily, and that Top-Yong was influencing the ward without legitimate authority. Top-Yong told him he was welcome to compare the patient records from the past 6 weeks across the different wards. Colin told him patient records were not an appropriate basis for deciding medical practice. One of the nurses appeared from the side room with a basin and distributed the contents of it over both of them, with the efficiency of someone who had broken up exactly this kind of argument before. Both men stood dripping in the corridor, and the nurse named 3 specific patients who had died of wound fever on the neighboring ward in the same period Top-Yong's patients had recovered. Colin had nothing to say to this. Top-Yong spent the following week compiling proper statistics. He pulled every record he could access, had Joseph and Alfred help collate the numbers, and produced a document showing the mortality difference between wards using hand washing and those that did not. The gap was not subtle. He presented it to Liston, not to Blundell, who held the obstetrics professorship and had a long professional investment in the theory that hospital illness came from bad air in the environment. Liston read the document, looked at the numbers 3 times, and announced a 1-month hand-washing trial for the entire surgical ward. Blundell objected in the faculty meeting, citing miasma theory and the tradition of physician sacrifice in the face of environmental hazard. He was dignified about it and completely wrong. Liston placed his knife on the table, and no one had further objections. After 1 month, the mortality rate on the trial ward had fallen by more than a third. Blundell came to Tapyong's workspace and sat with the numbers for a long time without speaking. Then he said he would like to discuss the implications for childbirth medicine. Tapyong made him tea and told him everything he reasonably could. The rubber gloves were ready by then. Colin had stopped making comments about superstition, at least within earshot of the nurses. Alfred had fully recovered and was asking Tapyong about next steps. Joseph was happy, optimistic, and constitutionally unbothered by most things. The wards were cleaner. The numbers showed it. Tapyong allowed himself one quiet evening of feeling like the work was going somewhere. The next morning, Liston invited him to a social gathering at a physician's house in Kensington, mentioning that several colleagues would be present and that there would be something worth seeing. He did not specify what. The house in Kensington belonged to a physician named Hartwell, who had inherited both the house and his medical degree from the same father, in roughly the same spirit of accepting things that were offered. He was a generous host. The rooms were warm, the food was good, and by 9 in the evening a significant number of London's surgical establishment had moved from the dining room to a large study where something was happening near the fireplace. Tapyong smelled it before he saw the source. Sweet, slightly metallic underneath. He identified it without effort and stopped walking. Nitrous oxide. Laughing gas, in the parlance of the parlor demonstrations that traveled through fashionable society like any other entertainment. A group of 4 men near the hearth were passing a rubber bladder between them, each taking a long breath from the nozzle and waiting for the effect. The laughter that followed was loud and slightly animal, the kind that empties the chest without requiring anything funny to have happened. One man sat on the floor because his legs had stopped working reliably. He seemed delighted by this development. Liston appeared at Tapyong's elbow and asked what he thought of the demonstration. Tapyong said he thought it was very interesting. He said it in a tone that communicated something quite different, and Liston, who was developing a reasonable ability to read him, looked at his face and then back at the men near the fire, and then back at his face, and asked him to explain that expression more specifically. They stayed until the last guests left. Tapyong spent most of that time collecting information he already possessed, but needed to verify in this body and this era. He asked Hartwell about the gas, framing it as curiosity about the chemical properties. Hartwell explained what he knew, which was accurate as far as it went, and stopped well short of the clinical implications. He mentioned that a Professor Humphrey Davy had done considerable work on the substance before his death, documenting its effects at various concentrations. Tapyong asked if any of Davy's research documentation still existed. Hartwell found it in his own library, a small bound manuscript with marginalia in 2 different hands. He lent it willingly, with the air of someone handing over a party novelty rather than a scientific document. Tapyong read it on the carriage back. The documentation was incomplete but precise in its observations. Davy had identified distinct stages of exposure, from mild euphoria through deep sedation to unconsciousness, and had noted that patients in the later stages reported no awareness of pain. He had not made the surgical application explicit. The connection was there in the data and he had not followed it. Tapyong could follow it. He spent the next 4 days thinking through the practical requirements, writing nothing down, working the problem in the space where his previous training lived, concentration management, delivery control, monitoring for the line between deep sedation and respiratory depression. He needed a reliable method of administering a controlled dose, a way to maintain it through a procedure, and a patient willing to test it before he brought Liston into it. The patient part was the difficulty. He needed someone healthy enough that the risk was minimal and bold enough to volunteer in full knowledge of what was being attempted. He looked at Joseph. Joseph looked back with the expression of someone who already knew what the next sentence was going to be. Liston surprised him. He had anticipated a conversation in which he presented the idea, and Liston evaluated it carefully over several weeks. What actually happened was that he described the Davy research and the proposed application, and Liston sat forward in his chair with an attention that was almost uncomfortable in its directness, and said he wanted to run a proper test. He said he wanted to use students rather than animals, because animals could not report accurately on their level of awareness. He said he wanted volunteers and that the test would involve dental extraction, because it was painful enough to constitute a real trial without the mortality risk of major surgery. Then he announced that the selection method would be a wrestling competition. Top-Young looked at him. Liston said he was entirely serious. The competition took place in the medical school courtyard. Several students participated. Joseph entered with goodwill and insufficient technique. Alfred watched from the edge with his arms folded and the expression of someone who had made a sensible decision. Colin won. He was technically capable and used a grip that was inside the rules if you read them generously, and he planted Joseph face first in the gravel with what Top-Young suspected was more enthusiasm than was strictly necessary. He stood up and brushed his coat and looked at Top-Young with his chin raised slightly. Top-Young walked over and told him he had volunteered to be the first patient. Colin's chin came down a fraction. He said he understood that. Top-Young told him there was no reason to be concerned. He said it in a tone that did nothing to remove concern. The extraction room was cleared and prepared. Top-Young had spent 2 days building the delivery apparatus, a modified bladder with a valve control that allowed him to regulate the gas flow, connected to a nozzle fitted precisely for the mouth and nose. He had tested the seal 3 times. He had the Davy manuscript open on the side table with the stage descriptions marked. Colin sat in the chair. His confidence was mostly intact. He had the posture of someone who had decided that showing fear was worse than the thing itself. Top-Young placed the nozzle over his mouth and nose and told him to breathe normally. The first effect came within 30 seconds. Colin's eyes changed, the tension behind them softening into something unguarded. His hands, which had been gripping the chair arms, went still. His breathing remained even, his color good, his chest rising and falling without distress. By 2 minutes, he was deeply sedated. He was not unconscious. He responded when Top-Young called his name, but the response was slow and distant, as if the name had arrived from somewhere far away. The dental student made the extraction. Colin did not react. His face did not change. He breathed steadily through the entire procedure, and his hands remained where they were, loose and open on the chair arms. Liston stood at the back of the room. When it was over, Top-Young removed the nozzle, and Colin came back into full awareness gradually, blinking, confused in the specific way of someone who knows they were somewhere else and cannot locate the transition. He asked if it had started yet. The dental student showed him the tooth. Colin looked at it, then at Top-Young, then at the tooth again. Liston walked to the window and stood with his back to the room for a moment. When he turned around, his face had the quality of someone handling something too large to process quickly. He said, after a pause, that he had spent his career performing surgery while patients screamed and then died anyway in the days following from infection and shock. He said this without drama, the way a person states a fact they have accepted because there was no alternative. He asked Top-Young how long the gas could maintain the sedation. Top-Young gave him the parameters: duration, concentration, the signs to watch for that indicated the dose needed adjustment, the indicators of distress. He spoke cleanly and without hesitation, because this was a space in which he had never been uncertain. Liston listened to all of it. Then he said he wanted a public demonstration within the month. Top-Young told him it was possible. He said it with more confidence than he felt, because the delivery system still needed refinement and the monitoring protocols were his alone to maintain. But the core idea was real, and it worked, and he was not going to qualify a working idea out of existence. The public demonstration happened at University College Hospital on a Tuesday morning in November. The patient was a laborer named Thomas, with a leg that had been infected since a work accident 3 weeks prior. The leg could not be saved. Liston had assessed it, and the amputation was already scheduled. Top-Young had spoken with Thomas the day before, explaining the gas, describing the process, answering his questions. Thomas had sat with it for a few minutes and then said that the previous time he had surgery, he had held 2 men down from the other side while they cut something out, and anything that might spare him that experience was worth trying. The gallery was full. Word had traveled in the way medical novelties traveled in London, through the physicians' dining tables and the nurses' corridors, until the room held more people than it was designed for. Liston stood at the head of the table. Top-Young positioned himself at Thomas's side, nozzle ready, valve set. He administered the gas. Thomas's breathing slowed, his eyes closed. His entire body, which had been rigid with anticipatory fear, settled against the table like a man finally getting to sleep. Liston looked at Top-Young. Top-Young nodded. Liston worked fast, which was his skill, and also, under these new conditions, no longer necessary. The crowd had expected speed from him, that famous sub-30-second performance. He moved at a measured pace instead. Every cut deliberate. No restraining needed. No screaming. Thomas breathed. The procedure completed. The wound was dressed. Thomas, when the gas cleared from his system 15 minutes later, asked a nurse to bring him water. The gallery was silent for a moment. Then it was not. The newspapers managed both the event and its meaning simultaneously. One paper described a miraculous Eastern technique. Another described the same event as probable fraud, noting that the patient had almost certainly been paid to perform unconsciousness. A third ran a full column questioning whether an Asian student should be permitted to introduce untested methods into British surgical practice, regardless of apparent outcome. Top-Young read all three at breakfast. Joseph watched him read. He folded the papers and set them aside and ate his toast and said nothing, because there was nothing to say that would change what the papers had already printed. Liston dealt with it differently. He attended a press gathering 2 days later and stated, plainly and without the diplomatic softening that characterized most medical pronouncements, that the demonstration had been genuine, that the patient had been unconscious, that this was not an Eastern superstition, but a chemical fact already documented by a British scientist, and that the student responsible for adapting it to surgical use had demonstrated during the public dissection last month a level of anatomical precision that he would describe, as a direct assessment, as equal to his own at the same point in his training. He said the last part looking directly at the reporter from the paper that had questioned Top-Young's credentials. He then asked whether anyone in the room had further questions, and added, casually, that he had his knife with him if they needed him to demonstrate anything else. No one had further questions. Top-Young, reading the transcript of this in the morning paper 2 days later, was quiet for a long time. Joseph read it over his shoulder and said that Liston was a good man underneath the knives. Top-Young agreed that he was. The graveyard was not somewhere Top-Young had intended to be at 11 on a Wednesday night. The chain of events that placed him there was mundane up to a point. He and Alfred had been returning from a late consultation at the hospital. Their route passed the Eastern Cemetery, which was close to the medical school, and therefore close to an ongoing trade in bodies that everyone knew about, and no one discussed directly. The medical schools needed cadavers. The cemeteries produced them. The connection between those two facts was managed by intermediaries who worked after dark and asked no questions. Alfred stopped walking. Something was moving near the third row of markers. Not an animal, the wrong shape for an animal, and the wrong rhythm of movement. It was slow and intermittent, like something that was trying to continue but could not sustain it. They looked at each other. They went closer. The coffin had not been fully reburied. It was half covered, disturbed by whatever had happened before the body snatchers had apparently been startled away. The lid was not sealed properly. Top-Young crouched next to it and pressed his ear close and listened the way 12 years of clinical experience had taught him to listen, with the specific quality of attention that strips away everything except the signal. He heard breathing, faint, barely there, but genuine. Getting the man out was difficult. Getting him to the hospital without being seen was worse. Alfred used money, which was efficient. A carriage appeared. The man was transported across the city in a state that made all three of them, driver included, wish for a faster horse. His name was William. Top-Young learned this later, from the hospital records. At that moment, in the examination room at 2 in the morning, he was a pulse and a set of failing vital signs and a body that had been sealed in an airless box for approximately 5 hours. The immediate problem was circulatory. William was severely dehydrated, his blood pressure barely findable, his skin cold in the way that had nothing to do with the November air and everything to do with how close to the edge he was. Top-Young had no saline solution, no intravenous apparatus, no blood products. He had boiled water, a length of clean rubber tubing, a large bore needle he had prepared for a different purpose and had been carrying in his bag with the vague awareness that he might eventually need it, and the comprehensive knowledge of what dehydration did to the human body and what slowed it down. He improvised a fluid replacement. The delivery was crude and he knew it. The quantity he could administer was limited by the equipment and the route. He worked through it systematically, monitoring what he could monitor with what he had, adjusting when adjustments were possible. Alfred held the tubing. Joseph held the lamp and did not ask questions. By dawn, William was breathing on his own with less effort. By afternoon, he was awake. Colin had arrived at some point during the night, possibly to look for Tapyong about something unrelated, and had remained because what he was watching was not anything he could identify within the medical framework he had been given. He sat in the corner of the room and watched and said nothing until the morning, when he told Tapyong quietly that he had not previously known it was possible to do what he had just done. Tapyong told him it was possible, but it required better equipment than he currently had, and that the next person in that situation might not be as lucky. He said this matter-of-factly. Colin absorbed this and left, and Tapyong turned back to William, who had opened his eyes again and was looking at the ceiling with the specific expression of a man considering how dramatically his week had changed. William, when he was strong enough to speak at length, had a problem beyond the obvious one. He described a pain in his face that had been with him for years, centered around his upper sinuses, bad enough in damp weather to make it difficult to work. He had been declared dead during a fainting episode, brought on by a combination of the pain and the fever, which was the kind of medical error that the era produced reliably, and that would not surprise anyone who had been paying attention. Tapyong examined him. The sinus cavity was badly inflamed, the passages partially blocked, the infection chronic and deep-rooted. In his first life, this would have been a scheduled procedure in a proper theater, with imaging and suction and a recovery team. He had what he had. He tried steam first, a simple approach, heated water in a bowl, with William leaned over it. The immediate relief was visible. For temporary management, it was functional. He showed William how to do nasal irrigation, explaining it as an Eastern technique for clearing pathways of disturbing energies, and William accepted this with less skepticism than most. The underlying problem needed surgery. Tapyong was honest about this, sitting with William and explaining it in terms that were simple and accurate. The procedure was not without risk. The sinus region was delicate. He was prepared to attempt it, but he wanted William's genuine consent. William said that the alternative was the pain continuing for the rest of his life, which based on recent evidence might be shorter than he had previously assumed, and that he wanted the surgery. They scheduled it. Colin showed up to help. Tapyong had not asked him. Colin appeared in the preparation room while Tapyong was laying out the instruments and said he had read about sinus anatomy and thought he might be useful for managing the bleeding. He said this in a tone that had most of its arrogance still intact, but was making a small effort towards something else underneath it. Tapyong considered him for a moment. He told him where to stand and what he needed him to do when he asked for it, and kept his explanation clinical and specific. Colin listened carefully. He asked one genuinely useful question about the approach angle. Tapyong answered it, adjusted his plan slightly based on the answer, and said nothing about the adjustment. Sometimes a person's competence appeared in unexpected places. It was worth noting without making an occasion of it. The surgery took longer than any procedure Tapyong had previously attempted in this life. He worked with anesthesia, which was now standard practice in his own theater, with gloves, with instruments he had cleaned to the limits of what this world could manage. The sinus cavity required precision because the structures around it were unforgiving, and the margin for error was not generous. Colin controlled the bleeding exactly as instructed. His hands were steadier than Tapyong would have predicted from watching him in dissection. William survived. He was comfortable within 3 days and reported that the chronic pain was already substantially reduced. A week after the surgery, a patient arrived with a stone. Tapyong could tell from the waiting room. The man's face had the particular compression of someone in sustained severe pain, the kind that had gone past the acute stage into the grinding endurance that says this has been like this for a long time. He moved carefully, each step calculated to minimize the jarring that made it worse. The stone was in the bladder. The senior surgeon confirmed it without ceremony and referred the case to a Dr. Kane, who specialized in stone removal and used a procedure with a mortality rate that Tapyong calculated, reading the hospital records that afternoon. sat comfortably above 50%. The conventional approach required opening the perineum, working blind into a cavity without illumination or proper access, and hoping the infection that followed would not kill the patient before the wound healed. Liston gave Tapyong 2 days to find an alternative. He told Blundell, who had become a steady if cautious collaborator since the hand-washing statistics, to let him know if 2 days was not enough. Blundell said that was the schedule. Tapyong spent the first day with the anatomical texts, working through the problem from the structural angle. The stone was large, visible on percussion if you knew what you were feeling for. The conventional approach avoided the abdomen because opening it was considered uniformly fatal. That was the assumption he needed to get around. The abdominal approach was not uniformly fatal. It was fatal when performed with dirty instruments, without anesthesia, without proper suture material, and by surgeons who had never done it. He had the first 3 covered. The 4th was a matter of preparation and nerve. He drew the incision line on paper. He planned the approach, the handling of the bowel, the access to the bladder, the extraction method for the stone, the closure sequence, the post-operative care. He wrote it out completely, then went through it again, removing anything that depended on technology he did not have. What remained was workable. He presented it to Kane on the 2nd day. Kane listened without expression and then said, flatly, that no one had successfully performed an abdominal surgery for stone removal, and that Tapyong was proposing to attempt something that had killed every surgeon who tried it. Tapyong said those surgeries had been performed without anesthesia, without proper sterilization, and without his specific approach to the abdominal layer. He said the patient's alternative was a procedure with a 50% mortality rate, and there was a reasonable argument that his proposal was not the riskier option. Kane looked at him for a long moment. He looked at Liston. Liston said Tapyong had his endorsement and that he would be present throughout. Kane said he would attend as well, in a tone that made it unclear whether this was support or supervision. Tapyong accepted it as both. The surgery took 3 hours. The stone was large enough that when it came out in his gloved hands, he could feel the edges of it clearly, smooth and irregular at the same time, like something that had grown in the wrong place for too long. He passed it to Alfred, who was assisting, and Alfred held it up toward the light and looked at it with an expression of genuine wonder. Tapyong closed the abdominal layer and told himself not to rush the suture. Rushing the suture was how closures failed. He worked methodically, each stitch placed where it needed to be, the layers rejoined cleanly. The patient slept through all of it. He was sitting up 3 days later eating solid food, which was not something the stone had allowed him to do comfortably for 2 years. Kane came to see him that morning and sat by the bed for some time. When he came out, he found Tapyong in the corridor and told him his technique had been sound and that he would like to discuss the approach further. Tapyong said he would be glad to. It was a formal thing to say, and both of them knew it meant something more than the words. Kane had been wrong about the surgery, and he was acknowledging it in the only way that was available to men like him, indirectly, through professional courtesy. Tapyong accepted it in the same way. The syphilis problem arrived through Alfred, which was how most complications arrived in that period of Tapyong's life, through someone close enough to make them personal. Alfred came to Tapyong's workspace one evening and sat down without being invited and stayed quiet for long enough that Tapyong put down the instrument he was sharpening and waited. A woman named Eleanor had worked for Alfred's family since he was a child. She had been a cook, and then a housekeeper, and then something closer to the person who kept the household functioning while the family conducted the business of being a family. Alfred described her as someone who had been kind to him at ages when most adults around him had been busy. He said this simply, without elaborating on what busy had meant for him. Eleanor was sick. A physician had diagnosed her. The diagnosis was syphilis, and the standard recommended treatment was mercury. Tapyong knew what mercury did to the human body. He kept his face composed and asked Alfred to tell him everything the physician had said. The mercury treatment for syphilis was not a secret cure. It was a known treatment with known effects, administered because it was the only significant intervention the era possessed, and because some physicians believed that the symptoms of mercury poisoning and the symptoms of advanced syphilis were difficult enough to distinguish that the damage done by treatment was being credited to the disease. The logic was circular, in a way that required genuine institutional investment to maintain. Mercury caused neurological damage. It caused kidney failure. In sufficient doses over sufficient time, it killed. The dose considered therapeutic and the dose considered dangerous were not comfortably distant from each other. Tapyong could not cure syphilis. That was the bare reality. He knew what the disease was, knew its mechanism, knew that the cure would not exist in this world for decades, and sat with that knowledge quietly because there was nothing useful in saying it aloud. What he could do was argue against mercury. He argued against it clearly and at length to Alfred. Alfred listened. He asked questions, the right questions, which made the conversation harder because it meant he understood the argument. Then he said Eleanor had trusted Dr. Seawise, who was the physician of the family, and had treated Alfred's mother before she died, and that Eleanor was frightened and wanted a familiar face and a treatment she recognized, and that Alfred did not think he had the standing to override what she had agreed to. Tapyong told him that standing was not the issue. The issue was what the mercury would do to her. Alfred said he understood that. He also said that offering Eleanor an untested alternative from a student who believed in Eastern energy disturbances was not something she would accept, and that insisting on it against her wish and her doctor's recommendation would be taking a choice away from her. Tapyong did not have an answer to this. He tried to find one and did not. The mercury treatment began. They did not speak much for 2 weeks. This was not dramatic. There was no confrontation, no ultimatum. They simply inhabited the hospital at the same hours and kept a distance that neither of them had created on purpose. Joseph noticed and stayed out of it with the wisdom of someone who understood that inserting himself would not help. Tapyong used the 2 weeks to search for something he knew he would not find. He read everything available in the medical school library on syphilis treatment, which meant reading variations of the same argument for mercury from different angles, with different levels of certainty and different mortality estimates buried in the footnotes. He wrote to a physician in Edinburgh who had published on the subject and received a courteous reply that contained no new information. He was trying to find a cure that did not exist yet, in a world that had not yet found it, and the trying was the only thing available to him. Eleanor, when he visited with Alfred's reluctant permission, was managing the mercury with the particular stoicism of someone who had decided to be grateful for any attention at all. Her hands shook slightly. The gums showed early signs of the inflammation mercury produced. She told Tapyong he was very kind to come and offered him tea. He drank the tea and talked to her about the garden behind Alfred's house in Surrey, which she could describe from memory with the precision of someone who had tended it for 20 years. Walking back, he thought about prevention rather than cure. The syphilis was spreading. That much was clear from what Blundell had mentioned in passing about the port areas and from what Tapyong could observe in the admissions records. Treating it was not currently within his capacity. Preventing transmission was a different question. He was already in the rubber manufacturing arrangement. The condom side of the business was producing results. He spent an evening redesigning the commercial specifications towards something that would work as reliable disease prevention, sent revised drawings to the manufacturer, and wrote a careful note to Alfred about the idea without framing it as anything other than a practical public health measure. Alfred came to the workspace the following morning. He read the note twice. He sat down and said that Tapyong had been right about the mercury, and that he should have argued harder. Tapyong told him the argument he had made about Eleanor's choice had been correct. He said it because it was true. Alfred said both things could be true simultaneously, and that he had not handled it well. They ate lunch together and did not mention it further, which was how the friendship repaired itself, not through a conversation about the repair, but through the resumption of ordinary things. 3 weeks later, Alfred was bent over a desk in the library, with his hand pressed flat against his lower right abdomen, and his face the color of old paper. Tapyong was there by chance. He had come to return a text and seen Alfred through the doorway, and what he saw in the posture and the color and the careful stillness of a person trying not to move because movement made it worse, told him the diagnosis before he had crossed the room. He put his hand on Alfred's forehead. Fever. Not high enough to be in crisis yet. He pressed carefully at the right lower quadrant, and Alfred made a sound and stopped himself from making more. Appendicitis. Acute. Probably beginning the previous night based on Alfred's halting account of when it had started. The timeline mattered. Early appendicitis was a surgical problem. An appendix that ruptured became a different category of problem entirely, one that this world's medicine was very poorly equipped to manage. He told Alfred what it was. Alfred asked what needed to happen. Tapyong told him surgery. He told him it needed to happen today. Alfred's family physician, Dr. Hewitt, arrived within the hour. He was a careful man with good intentions and a strong professional relationship with a medical framework that did not include emergency abdominal surgery as a first-line response to abdominal pain. He examined Alfred and diagnosed the same thing Top-Yong had diagnosed and then recommended rest, warm compresses, and monitoring. Top-Yong asked him, politely, what his timeline was for surgical intervention if the conservative approach did not resolve the problem. Hewitt said that abdominal surgery was an extreme measure, that Alfred was young and strong, and that the body often resolved these inflammations without intervention. Top-Yong was aware that this was occasionally true. He was also aware of what happened when it was not true, and there was a ruptured appendix and no capacity to manage the consequences. He asked to speak with Alfred alone. Alfred's father was present, a large and courteous man who treated the room with the confidence of someone accustomed to being the decision-making center of any gathering. Top-Yong had met him twice. He was not unkind. He also deeply trusted Hewitt and had known him for 30 years. Top-Yong told Alfred quietly what he had told no one directly before. He did not reveal his previous life. He said that he had extensive knowledge from Eastern medical sources of precisely this type of internal inflammation, that he knew how quickly it could become dangerous, and that he was asking Alfred to trust his assessment over the conservative recommendation, knowing what that trust required and not asking for it lightly. Alfred lay still for a moment. His fever had risen in the hour since the examination. His color had not improved. He called his father back into the room and told him he wanted Top-Yong to perform the surgery. He said it without qualification. Alfred's father looked at Top-Yong. He looked at Hewitt. He asked his son once if he was certain. Alfred said he was certain. The preparation took 40 minutes. There was no time to waste on anything unnecessary, and Top-Yong did not waste any. Joseph brought the surgical equipment already cleaned and arranged because he had started the moment Top-Yong told him what was happening, before being asked, because he had spent enough time in the orbit of Top-Yong's medical work to recognize an emergency by the pace of a corridor walk. Alfred was unconscious within 3 minutes of the gas administration. Top-Yong checked his breathing, checked his color, confirmed depth of sedation, and made the incision. The appendix was inflamed and distended and had not yet perforated. The margin was closer than he would have liked, and he moved through the procedure without pausing to consider that this was one of his closest friends under his hands, because considering that would not help Alfred and would not help the surgery. He located the appendix, isolated it, ligated the base, removed it, confirmed the closure of the stump, irrigated carefully, and closed the incision layer by layer with the suture technique he had now used enough times that his hands moved without conscious instruction. Alfred's color held throughout. His breathing remained steady. Top-Yong stepped back when the last suture was placed. His own hands, he noticed, were not entirely steady. He pressed them flat on the edge of the table for a moment and breathed. Joseph was watching from the doorway. He said nothing. He went to find Alfred's father. Alfred woke up that evening. He looked at the ceiling for a while. He looked at Top-Yong, sitting in the chair beside the bed with a medical text open in his lap that he had not been reading. He said he was hungry. Top-Yong told him that was a good sign. He called for broth and did not tell Alfred how close the timing had been, because Alfred did not need that information to recover, and knowing it would only be a burden. Alfred's father stayed in the room that night. He did not speak to Top-Yong directly until the following morning, when he came into the corridor and stood beside him for a moment and said, simply, that he was grateful. He said it with the directness of a man who did not normally give that word to people and therefore gave it full weight when he did. Top-Yong said it had been necessary, and he was glad it had worked. That was the end of the conversation, and it was sufficient. The rabid dogs came with no warning and little ceremony. London had strays, as every city did, and the particular cluster that appeared in the autumn weeks that followed Alfred's recovery were not obviously different from any others. The difference emerged through behavior. Top-Yong saw 2 of them in the same week, moving wrong, the coordination off in the specific way that indicated something had happened to the neurological system. One was crouched against a wall near the market, with its head down and its eyes unfocused. The other was running directly into things. He knew what rabies looked like. He had not expected to encounter it here in this form and severity, though he understood why it was present. The bite patterns from the hospital records showed a cluster of recent admissions. People were treating bite wounds with cauterization, which did nothing about the virus and simply added a burn injury to an already serious situation. Liston organized a response through the hospital and the local authorities, focused on containing the dogs. Tapyong worked alongside the effort, spending his time on wound treatment for bite victims, cleaning the injuries properly rather than burning them, explaining that the cauterization was causing additional damage without preventing the disease. The hard part was what came after proper wound care. Wound cleaning was not enough. Once rabies developed symptoms, the outcome was effectively certain, and he had nothing available to him that changed that. He was cleaning wounds and watching and hoping, and the hope was the thinnest part of the equation. Emily was 8 years old. He did not know her name was Emily when the bite happened. He learned it afterward from the girl's sister, who was older by a few years and had accompanied Emily to the hospital, with the composure of someone much older still, holding her sister's hand and speaking to the nurses with a directness that came from having no time for anything that was not directly useful. The bite was on Emily's left forearm, clean, deep, from an animal that fit the description of one of the confirmed cases from earlier in the week. Tapyong cleaned the wound himself. The sister gave her name as Charlotte, and she introduced Emily clearly and carefully, and in the moment Tapyong looked at the two of them together, at their faces and the quality of attention in both of them, and the way the younger one watched everything around her with the particular focus of someone storing it all. Something registered that was not quite recognition and not quite certainty. He had read Wuthering Heights in his first life. He had not thought of it in years before that moment. He looked at Emily, who was watching him work on her arm, with the unfrightened curiosity of someone who found things more interesting than frightening, and understood clearly what he was looking at and what it meant if he failed. He told Charlotte that the wound treatment was thorough and that he would want to monitor Emily closely over the coming days. He said this carefully, giving her accurate information about what the monitoring was for, without specifying the prognosis for established rabies, because the probability of exposure developing into disease was not 100%, and frightening Charlotte with numbers that might not apply served no one. Charlotte thanked him with the same composure and took Emily home. Tapyong spent that evening at his desk. He was working backward through what he knew about rabies, from the modern understanding he carried in his previous life memory, into the practical question of what that understanding suggested about what might be possible to do here. The disease was caused by a virus. The virus traveled along nerve pathways to the brain. The window between exposure and symptom onset was variable, weeks at minimum, sometimes longer. That window was everything. He knew there was a principle, documented in his original era and traced back to work done in France, that weakening a pathogen through desiccation could produce a preparation capable of prompting immune response without causing full disease. The principle was not mysticism. It was attenuated immunization, and it worked because the immune system was not discriminating about whether the trigger was strong or weak, only whether the trigger was present. He did not have a laboratory. He did not have sterile controlled conditions. He had a rabid dog's brain, which he obtained from the containment effort through Liston, and a set of thin wire frames over which he could stretch the material to dry in conditions that needed to be dry and cool and free from contamination. He had no greenhouse, which was the critical problem, because the October rain was intermittent and his boarding house room was not a suitable preparation environment. Colin learned about it somehow. He appeared at the hospital where Tapyong was explaining the problem to Joseph and Alfred, and listened for several minutes without announcing himself, and then said that his family had a heated greenhouse on their property in Hammersmith and that it was not currently in use. Tapyong looked at him. Colin said, without inflection, that he supposed the girl's life was probably more important than the awkwardness of the situation. Tapyong told him the greenhouse would be sufficient and thanked him without making more of the thanks than was appropriate, which Colin would have found uncomfortable. The preparation took 9 days. He visited Emily 4 times during that period. She was healthy, bright, engaged, showing none of the early indicators he was watching for. Charlotte was present at each visit and asked the right questions and absorbed the answers with careful attention. She did not ask what the prognosis was without treatment. Tapyong suspected she already knew and had decided that knowing with precision was not what she needed at this stage. The drying sequence progressed as planned. He monitored the samples daily, inspecting the preparation through the greenhouse glass, adjusting humidity where he could, working with the basic instruments he had been able to acquire, and what his previous life knowledge supplied in place of the equipment it could not. When the preparation was ready, he sat with it for a long time. He was about to ask a healthy child to accept a treatment derived from infected brain tissue, prepared under primitive conditions, without controlled testing, without the ability to confirm dosage, without any immunological monitoring capacity, because the alternative was watching a probable disease develop in a girl who had not yet written the things she was going to write. He was also doing it because she was 8 years old and frightened would be the wrong word for her, but exposed was the right one, and he had something that might protect her. He brought it to Charlotte first. He explained the principle clearly, without simplifying it in the ways that concealed rather than clarified. Charlotte listened without interrupting, asked 2 questions when he finished, and then said she wanted to speak with Emily. She came back 10 minutes later and said Emily wanted to understand what it was before she agreed to anything. Tapyong went in and explained it to Emily. Emily asked him whether the animal had been genuinely sick or just behaving unusually because it was upset. He told her it had been sick. She asked if his preparation would work. He told her honestly that he believed it would, that the principle behind it was sound, that the specific conditions of preparation had been as controlled as he could make them, and that he could not give her certainty because certainty was not something medicine offered. Emily considered this. She said that sounded like an honest answer. She said she would take the preparation. He administered the first dose that afternoon. The days following were the most unpleasant stretch of Tapyong's second life. He had no way to monitor what was happening inside Emily's immune system. He had the external indicators, her temperature, her behavior, the appearance of the injection site, the presence or absence of early neurological signs, and he checked them every day, and they told him only what was visible. What was happening at the level that mattered was invisible to him. Emily was a calm patient. She asked him questions about medicine at each visit, specific questions about how the body recognized foreign material and what the process of becoming immune actually involved. He answered carefully, framing things in terms the era could accommodate, but not simplifying them to uselessness. She listened with that same unhurried attention. The full incubation window passed. The neurological signs did not appear. He continued monitoring for 3 more weeks past the expected onset point. Nothing. Emily was well. He was sitting at his desk the evening he allowed himself to accept it as certain, rather than probable, and he had no one to tell in the way he might have wanted to tell someone. Joseph knew, Alfred knew. The relief they expressed was genuine but general, because they had not been carrying the weight of knowing specifically who Emily was and what she had not yet done. Tapyong sat with it alone for a while, and that was sufficient. He wrote up the preparation method and the case notes in the most careful and complete terms he could manage, because the documentation was the thing that would outlast the secrecy. If it existed in writing, it could survive him. Blundell found him in the hospital corridor a week later and said he had heard about the case. Tapyong waited. Blundell said that he had been thinking, in light of the hand-washing data and the anesthesia results, and the abdominal surgery and now this, about the pattern of Tapyong's interventions, and that the pattern suggested a conceptual framework that he could not fully identify, but that appeared to involve treating disease as something with a definable cause rather than as an environmental phenomenon. Tapyong said that was a reasonable description of his approach. Blundell said he would like to discuss it further. He said it with the manner of someone who had spent 2 years being wrong about hand-washing, and was now taking his time before being wrong about the next thing. Tapyong said he would be glad to discuss it, and that he would appreciate Blundell's perspective, because he meant that genuinely. The era's doctors were not stupid. They were working with an incomplete framework and filling the gaps with available logic. The logic was wrong because the framework was wrong, not because the people were wrong. Blundell was intelligent and careful and increasingly willing to question the framework. That made him more valuable than most. Willow Bark had been on Tapyong's list since his first winter in London. He had watched the nurses manage post-operative pain with opium compounds that worked and created dependency and were the only realistic option available, and he had thought repeatedly about the chemical compound that Willow Bark contained, which the next century would extract and refine and call aspirin. He could not extract it with precision. He could prepare a decoction with concentration enough to be useful, which was what traditional medicine had always done with the bark, and which produced an effect that was real, if not equivalent to what the pure compound would achieve. He worked on the preparation through the autumn, running small controlled comparisons with patients who had given consent for the experiment, measuring pain reports and fever response against the opium standard. The results were modest for severe pain and meaningfully better for mild to moderate discomfort and fever reduction. He gave Blundell the notes. Blundell read them and said he supposed the next question was what else was hiding in common plants that no one had thought to test properly. Tapyong said that was exactly the next question, and that the answer was probably a significant number of things, and that the testing would take longer than either of them had time for. It was as close as he had come to saying something true about the shape of the future, and he watched Blundell's face to see if anything landed wrong. Blundell only nodded and went back to the notes. The willows along the Thames had been there for centuries. What they contained had been there the same length of time, waiting for someone to ask the right question. It was not a unique situation. Tapyong was increasingly aware that the history of medicine was largely the history of asking questions that the previous generation had been standing next to and missing. He filed the notes and moved on to the next problem, which was the cadaver shortage, which was the problem that led, through a sequence of events he could not have predicted, to Princess Victoria. The cadaver shortage arrived as an administrative problem before it became a human one. The medical school required bodies for dissection, and the supply had always been precarious, managed through arrangements that the institution acknowledged indirectly and the body snatchers managed directly. When the police began enforcing the burial protection laws with genuine seriousness, the supply contracted and the dissection rooms began running short, and the dean circulated a memorandum about the situation that contained no proposed solution. Liston brought Tapyong into the conversation about alternatives. One of those alternatives was the police themselves, who occasionally had access to bodies through the criminal justice system and were willing to discuss arrangements, particularly if the arrangement came with something useful in return. The useful thing turned out to be a forensic examination. A woman had been found unconscious in her home by a neighbor and transported to the hospital, where she had been examined, declared dead, and moved to the preparation room. The preparation room was where bodies waited before transport. It was not a place people typically left under their own power. The constable who came to the hospital the following morning was there about the original incident, not the death. He wanted information about injuries consistent with a fall. He was shown to the preparation room and opened the door, and found the woman sitting on the edge of the table, with her feet dangling and a very confused expression. This caused considerable disruption. Tapyong was sent for, because he had by now acquired the reputation of being the person to send for when something medically unusual was happening and a conventional explanation was not immediately available. He arrived to find the woman drinking water and the preparation room attendant standing in the corridor looking at the wall with the manner of someone reconsidering several things simultaneously. She was alive with the specific quality of aliveness that came from having been very close to the other condition. Her pulse was present but weak. Her color was returning slowly. She had been in a deep unconscious state that had not produced the breathing depth visible to a casual examination, which was how the error had occurred. He thought about this for a long time after she was moved to a proper ward and given appropriate care. The problem was the examination itself. There was no reliable way to confirm death without better tools for detecting faint vital signs. A physician who could not hear a faint heartbeat could not be blamed for missing it, but the patient could certainly be blamed for the consequences. He described the problem to Joseph that evening, drawing on paper as he talked, sketching the concept of a device that used the principle of sound amplification through a stethoscope configuration, a tube, pressed to the chest, that conducted heartbeat sound directly to the ear. He had produced crude versions of this idea before. He drew a better one now, with the specific measurements that would make it functional. Joseph asked if it would actually work. Tapyong said there was no reason it would not, because it was essentially a tube. Joseph said that most revolutionary things were essentially tubes or levers when you described them correctly. Tapyong had the device built within a week. It worked on the first test. He used it on the woman in the ward, confirmed her heartbeat clearly through the chest wall, and handed it to Blundell, who listened and looked up with an expression that Tapyong had become familiar with by then. The particular expression of someone in the process of realizing that something obvious had been waiting to be invented and had simply not been invented yet. The Royal Opera House was not somewhere Tapyong had expected to perform surgery. The public dissection had been suggested as a solution to two problems simultaneously. The medical school needed cadavers. The arrangement with the police required a demonstration of medical value that could be seen as a public benefit rather than an institutional convenience. Someone in the dean's office, working through these two problems on the same afternoon, had arrived at the idea of a public anatomical demonstration. Public anatomical demonstrations had a history. They had been performed in theaters and lecture halls and, apparently, opera houses. The opera house was available for a Thursday, and the dean confirmed the booking before anyone could object seriously. The condemned prisoners whose bodies had been made available were a solved problem by then. The forensic work had produced information useful to the police. The arrangement held. Taepyeong stood in the wings of the Royal Opera House on the Thursday morning and considered that his second life had taken him to some places his first one had not. The house was full. He had not expected a full house. He understood it intellectually, that public demonstrations had always drawn crowds and that this one had been sufficiently described in the press to generate interest. But the reality of standing in the wings and looking at an opera gallery filled with ordinary Londoners who had come to watch anatomy was different from understanding it as a concept. Liston appeared beside him and said the crowd was better than expected. He said it with satisfaction. Taepyeong asked him if he had sold tickets. Liston said he had mentioned it to a few people. He performed the demonstration for 11 hours. The neck anatomy was the centerpiece, because it was the region he had been asked most specifically to address by Liston, who had been interested in the tracheostomy technique since Taepyeong had first demonstrated it on an emergency basis after a bicycle accident the previous month. A man's airway had been compromised by blood after a fall, and Taepyeong had made the incision in the street with the instruments he had in his bag, directed Liston's hands through the tube placement by description alone, and they had kept the man breathing until the hospital was reached. Liston had been thinking about it since. The public demonstration placed the neck anatomy in front of an audience that included doctors, students, journalists, and people who had simply come because they were curious. Taepyeong explained each structure as he worked, keeping the language accessible because the audience was general, and the goal was understanding rather than technical display. He explained the airway. He explained what it meant when the airway was blocked. He explained that an incision in the correct location, performed correctly and quickly, could maintain breathing when nothing else could. Someone in the gallery called out a question about whether the procedure was safe. Taepyeong said it was safe when performed with proper understanding of the anatomy, considerably safer than dying from airway obstruction, and that the question of safety in surgery was always a comparison between the risk of the procedure and the certainty of the alternative. There was a ripple of response through the gallery. Not laughter exactly. Recognition. He worked through the afternoon and into the evening, the demonstration expanding beyond the prepared material into responses to questions from the gallery, which kept coming because the audience was engaged in the way audiences sometimes became when they were given credit for being able to follow something serious. He became exhausted around hour 8 and continued anyway because stopping would have been worse than continuing, which was a feeling he recognized from his first life and was not surprised to find present in his second. He was helped off the stage after hour 11 by Joseph, who had been watching from the wings with the steady presence of someone who had decided his role was simply to be there. There had been a young woman in the gallery. He had noticed her because she asked the best question of the evening, delivered in the precise and unembellished manner of someone who had prepared it in advance. She asked about the relationship between the tracheostomy and the respiratory problems associated with diphtheria, specifically whether the procedure could extend the window of survival in pediatric cases where airway swelling was the primary danger. He had answered her fully, because the question deserved a full answer. He learned who she was the following week, when a royal summons arrived at the medical school, addressed to him, written in a hand that belonged to a secretary, but referenced details from the opera house demonstration that suggested the actual author had been present. Princess Victoria received him in a small sitting room that contained more books than furniture, which told him something useful about how she spent her time. She was young, direct, and apparently uninterested in the indirect approach that characterized most communications he received from people with authority over other people. She said she had found the demonstration considerable, and that she had several questions she had not been able to ask from the gallery. Taepyeong answered them. She had 4 more after that. He answered those as well. They spoke for 2 hours. She made notes in a small leather book in a handwriting that was fast and compressed, the writing of someone who found the pace of thought faster than the pace of transcription and had adapted to that problem through efficiency rather than neatness. At the end of the conversation, she asked him what he most needed for his work. He had thought about this possibility on the carriage over, not because he expected the conversation to go this direction, but because a trained mind prepares for useful contingencies. He had a list. At the top of it, above everything else, was a microscope. Not the kind available through the school. A proper one, the most powerful optical instrument that current manufacturing could produce, capable of sufficient magnification to make organisms visible that were currently invisible, that existed in water and on surfaces and in diseased tissue, and that Tapyong knew were there because he knew what had caused every death from infection he had witnessed in this city, without being able to prove it to anyone. He explained what he needed, giving her enough of the reasoning to justify the request without turning it into a lecture. Victoria made a note in the small book. A microscope arrived at the medical school 3 days later, in a case that required 2 men to carry. The organisms were there. He put contaminated water under the lens, and they were simply there, moving in the field of view, identifiable, undeniable. He put clean water next to it, and the contrast was immediate. He put material from a wound on a cadaver and found the same organisms present in concentration. Liston looked through the lens for a long time without speaking. He said, eventually, that he would like to see the comparison again. Tapyong prepared it, and showed him the clean sample and then the contaminated one. Liston did not say anything for another long moment. Then he said that if those things were genuinely causing the infections, and if they could be shown to cause disease under controlled conditions, the implications for everything they had been arguing about for the past 2 years were larger than he had previously understood. Tapyong said that was accurate. Liston said he supposed they needed a proper experiment. He had been thinking about how to design the experiment and how to make it ethical simultaneously, which were not always easy conditions to satisfy together. The contaminated water in the Thames was the source he had been examining. The organisms he could see in the river samples near the hospital outflows were present in much higher concentration than in clean water drawn from upstream. He needed a group consuming contaminated material and a group consuming clean material, with monitoring of both groups over a sufficient period. The problem was the human element. He had told Liston he would not conduct the experiment unless the contamination was diluted enough to make severe illness unlikely, and unless the monitoring was rigorous enough to manage any response that occurred. He had told himself the same thing more forcefully. Liston announced to the senior students that he was looking for volunteers for a controlled experiment involving water quality and health outcomes. He described it with his characteristic directness, which meant he described it accurately and left out the framing that made unpleasant things sound comfortable. Colin volunteered. This was becoming a pattern with him, the willingness to put himself into situations that were genuinely uncomfortable when the alternative was watching someone else occupy a position of useful bravery. Tapyong had stopped finding it surprising and started finding it characteristic. 6 other students volunteered alongside him. The contaminated group began the experiment on a Monday. By Wednesday, 2 of them had developed nausea. By Thursday, the nausea had become vomiting for 3 of them, and a 4th had developed the specific pattern of severe systemic response that told Tapyong the dilution had not been sufficient for everyone. He had hoped for mild demonstrative illness. He had planned for moderate illness. What he had in front of him by Friday morning was 1 student in serious condition, dehydrated past the margin where fluid replacement was a comfort measure and into the territory where it was the urgent priority. The nurses worked through the night. He had not asked them to. He had organized what he could organize: the fluid replacement apparatus, the monitoring rotation, the treatment protocols. He had done this in the corridor while one of the senior nurses, a woman named Margaret who had worked on the ward since before Tapyong arrived, and had watched the hand-washing reform happen, with the practical approval of someone whose work involved cleaning up the consequences of infection, simply began directing her colleagues through a night shift that no one had put on the schedule. He stood in the corridor at 3 in the morning and watched them move through the ward with the competence of people who had spent their careers learning to be competent in conditions that rewarded nothing else, and felt something that he did not have a simple word for, but that involved the awareness that the work did not belong only to him and had never belonged only to him. The student with severe symptoms was breathing with difficulty by midnight. Tapyong used the bellows ventilation technique he had improvised before, the crude mechanical assist that was nowhere near what proper respiratory support looked like, but maintained oxygenation in the gap between where the patient was and where they needed to be. He maintained it for 2 hours with Alfred taking turns beside him, until the student's breathing stabilized on its own. By morning, everyone was alive. The clean water group was entirely well. The data was unambiguous, sitting in the monitoring records that Margaret had maintained through the night with the same rigorous attention she gave to everything. The sick students precisely documented, the clean students precisely documented. The evidence for what the contaminated material had done recorded in the kind of detail that made it difficult to dismiss. Liston looked at the records and said he wanted to take them to Paris. The professorship became a problem before it became a solution. Liston had decided the research warranted international presentation and had organized a visit to the French medical establishment that would require both of them to be present and credible. The credibility problem was straightforward. Tapyong was a student. The research he had produced could be attributed to him honestly, but presenting it internationally while carrying a student's institutional status was a difficulty that Liston acknowledged without immediately knowing how to resolve. The director of the medical school had a view on the matter. His view was that making a student a professor, in order to solve an administrative problem, created its own administrative problems, and that the situation would benefit from conventional patients. He expressed this in a faculty meeting. Victoria was not at the faculty meeting. Her note arrived before the meeting adjourned. It was short, written in that compressed, efficient hand, and it suggested that the medical school might consider the question of Tapyong's status in light of the contributions he had made to medical practice and research, and that she would be personally interested in the outcome of their consideration. It said this in terms that were suggestions in the way that suggestions from royalty were suggestions, which was with a weight that made the alternative positions difficult to occupy comfortably. The faculty voted unanimously. The office was small. It had a window that faced the courtyard and a desk that had belonged to someone before him, and a chair that was slightly too large, and a shelf along the wall that was currently empty. Tapyong stood inside it after the ceremony and was quiet for a moment. He had stood in a hospital corridor in his first life with a promotion letter in his hand, and then he had walked outside to get food, and then a vehicle had hit him, and the office he had earned had remained empty as far as he knew, because he had never seen it. This one he could see. The window let in the gray November light, and the courtyard sounds came up faintly through the glass, and the shelf waited for whatever he put on it. He put his hand flat on the desk surface and stood there briefly, acknowledging it, and then he pulled out the chair and sat down and began reviewing the preparation list for the Paris journey, because there was work to do. Colin knocked on the doorframe 20 minutes later. He came in and stood in the middle of the room with his hands behind his back and his posture extremely correct, and said he wished to formally acknowledge the appointment and to clarify his intention to conduct himself appropriately in all future interactions. Tapyong looked at him. Colin held the posture and said that he understood Professor Kim would be responsible for his evaluations going forward. Tapyong told him that he would be evaluated on the quality of his medical work and his engagement with patients, same as any other student, and that he hoped Colin would continue developing the genuine surgical ability he had demonstrated during the sinus procedure and the follow-on work. Colin received this with the specific discomfort of someone expecting a harder landing. He said he appreciated that. Tapyong said he also appreciated that Colin's greenhouse had been available when it was needed. This was not a thing Colin had expected him to say. He was quiet for a moment and then said that it had not been a significant inconvenience. Tapyong told him he could go and that he would see him at the next ward round. Colin left. Tapyong heard his footsteps going down the corridor, measured and unhurried, the walk of someone recalibrating. Liston came to the office that evening with a bottle of something old and 2 glasses and the research papers under his arm. He said he wanted to discuss the Paris presentation. He also said, before they started, that the research would be attributed to both of them as co-authors, and that he understood Tapyong might have concerns about whether an Asian name on a European medical paper would produce the reception the work deserved. Tapyong said he did have that concern. Liston said the concern was legitimate and that the answer was to put the name on the paper anyway, because the alternative was allowing the work to be separated from the person who had done most of it, and he was not willing to do that. He said this with the flatness of a man stating a position that was not open for revision. Tapyong looked at him across the desk and felt the particular quality of gratitude that does not have a comfortable way to be expressed to someone who would find expression uncomfortable. He said they should discuss the presentation structure. They talked through the night, the papers spread across the desk, and the bottle diminishing slowly. Two doctors organizing how to tell a medical establishment in another country that significant portions of what they believed about disease and surgery were wrong. The preparations for France required more equipment than Tapyong had originally planned. Liston kept adding items, methodical and systematic, and the list expanded until Alfred's family carriage was no longer adequate and a second vehicle had to be arranged. Alfred managed this without complaint. Joseph packed his own bag with the cheerfulness of someone who had decided that wherever Tapyong was going was probably going to be interesting. The ship left on a morning with low cloud and flat water. Tapyong stood at the rail as the London dock receded. He thought about his parents, the ones from this life, who had come from somewhere far away to a country that was not their own and built a life in it through the patient accumulation of ordinary days. He had not done the same thing exactly. He had arrived differently and under different circumstances and with different knowledge. But he understood something of what they had done that he had not understood when he was younger. The water was gray and cold, and the gulls followed the ship for a while and then stopped following it. The storm came on the second day. It was not a severe storm by the standards of the North Sea in autumn. It was severe enough that a passenger on the upper deck, moving along the rail toward the shelter of the main cabin, slipped on the wet deck and fell badly against the railing, and was found by Joseph sitting on the deck holding his right arm and unable to move it. Tapyong examined the arm in the ship's small interior room, with Liston watching. The fracture was clear on palpation, a midshaft break without displacement at the moment, but the potential for displacement present if the limb was not properly managed. The ship's movement made everything more difficult, and Tapyong worked with one hand on the surface beside him for stability. Liston said the arm would likely need to come off. Tapyong told him it would not. He said this without looking up from the examination. Liston said that fractures at that location in these conditions, with no proper surgical theater available and the risk of delayed treatment producing complications, had historically been managed by amputation. Tapyong said he understood the historical management and that he was proposing a different approach. He said it calmly, because arguing with Liston about methodology had become a normal feature of their working relationship, and the calm was genuine rather than performed. He set the fracture. He used the technique he had practiced in his previous life on patients who could not be taken to surgery, the careful manipulation of the bone back to alignment through external handling, checking the position with palpation because imaging did not exist and palpation was what he had. He splinted the arm with material from the cargo and wrapped it firmly enough to maintain position through the remaining sea movement. The passenger, a merchant from Bristol named Davies, who had spent the entire procedure sweating and managing himself with impressive discipline, thanked him with the sincerity of a man who had believed he was about to lose an arm. Liston examined the splinted limb for a long time. He said the reduction appeared adequate. Tapyong said it was adequate. Liston said, with the specific quality of assessment he reserved for things that genuinely impressed him, that the technique was worth documenting. Tapyong said he would write it up during the crossing. France appeared through the morning fog on the fourth day, the coastline resolving gradually from gray into detail. The port was busy with the industrious disorder of a major entry point, and beyond the port, the city rose in the way Paris rose, with the weight of a place that had been building itself for centuries and had not finished. They disembarked in the late morning. Alfred organized the luggage with the competence of someone who had decided that being useful was more valuable than preserving his coat from the dock. Joseph stood beside Tapyong and looked at the city and said it was very large. Tapyong agreed that it was. What he was looking at was not the architecture, he was looking at the people. The density of sick people visible even from the dock was not what he had expected. Not the ordinary proportion of illness that any city carried, but something elevated, something that showed in the way people moved, and in the faces he could see in the street beyond the port gate, and in the quality of care visible at the fringes of the crowd, where people who were not managing well had stopped moving. He counted it. Not formally, but the instinct was there, the same one that had told him Alfred's abdomen was wrong before he touched it, reading the environment rather than a single patient. something significant was happening in Paris. He did not yet know what it was, but the scale of it was visible from the dock, and the scale told him that whatever they had prepared to present was going to be secondary to whatever they were about to encounter. He picked up his medical bag and walked through the port gate into the city.